Hello and welcome to this episode of Health and You. I am Sumi Sukanya Dutta, and today's topic of discussion is obesity, its effect on metabolic health and its management. To put it in context, between 80 to 100 million people in India are estimated to be obese. To discuss this, we have two illustrious guests with us, Dr. Ambrish Mithal and Dr. Rajiv Kovil. Dr. Mithal is a chairman and head endocrinology and diabetes with Max Super Speciality Hospital in Delhi, and Dr. Kovil is the founder of Dr. Kovil's Diabetes in Mumbai. Thank you so much, Dr. Mithal and Dr. Kovil, for agreeing to have a chat with us on this. We have known for a long time that obesity can lead to serious health concerns, but perhaps we have not yet reached that kind of stage where in itself it is seen as something which needs to be managed. Dr. Mithal, please share why obesity has become such a mega challenge in today's world and also in India, and why and how it leads to severe metabolic conditions and can be a root cause of various other diseases.
Hello, thank you. Thank you for having me here. Uh, you're absolutely right. Actually, obesity in modern parlance is the mother of all diseases, all
Right.
non-communicable diseases, and even outcomes of some infectious disease are dependent on obesity. So
Absolutely.
I think we need to look at the rising trend of non-communicable disease and link
Mm-hmm.
it to obesity. And when we say non-communicable disease, we NCD, we mean diabetes, we mean heart disease, blood pressure, we mean what we call fatty liver, several types of cancers. So there's a whole list. Now, the common stem from which all these arise is excess body fat.
Right.
Obesity, by definition, means body fat that is excess of what it should be. Now, that's a slightly vague definition, but that is the physiological definition of obesity, right? So, when we have excess body fat, in particular, if it's a central or visceral fat, fat around our viscera, around our inside our tummy, that body fat leads to all these conditions. It produces various inflammatory cytokines, we call them, toxic substances in the blood. uh, Overall inflammatory parameters go up, and that's how we get into this mess of all these conditions. Now, if you look at, you described about obesity going up, so the whole thing moves up with that. So when we say diabetes has gone up in India, it means it has gone up because obesity has gone up in India. So if we have
Yeah.
to address, it's important that we address obesity by addressing our excess body fat, not allowing it to happen. We'll be protecting ourselves from not just weight per se, but a whole gamut of disease, which is why WHO classifies obesity itself as a condition,
Right.
as a disease which requires treatment, because you're protecting yourself from so many conditions just by addressing that. I
Yeah.
think it's important that we understand, and this process, of course, why it's gone up is a separate question. If you want, I can answer that now. But the process starts very early. It actually probably starts in utero, even when when the baby is not born, throughout, infancy, childhood, adolescence. When people are overweight, when kids are overweight, they become overweight adults, and they get into all conditions associated with obesity. For example, for children, adolescents, a polycystic ovarian disease, PCOD, another example, which is linked to obesity. So
Right.
that is the chronological sequence of things.
Yeah. So two important messages there. One, it has to be prevented. When you see your weight rising, you have to control it. And also, you have to see obesity in itself as a problem and try to prevent it. Uh, Try to control its rise further so that other diseases don't happen. Right. Dr. Kovil, in your view, why is weight management important and how much may be too much? When do I know that, for instance, I have a problem? Also, why do women tend to have more of obesity problem as compared to men?
Fantastic question to me is that how much is good, how much is bad is a question which no one can answer, because there are a lot of metabolic abnormalities in people with excess fat, or we can call them obese, that as Dr. Mittal said, is the mother of NCDs, and it drives cardiovascular disease, chronic kidney disease, heart failure, diabetes, cancers across the globe. Now, this particular excess deposition of fat is there's a genetic, like heredity loads the gun, and the circumstance and the surroundings pulls the trigger for it. So per se, how much is so there are a lot of ways of actually analyzing obesity, and the older one was body mass index, and today we realize that Indians are the thin fat Indians. So even if we are thin, we still have a pot belly. So probably body mass index is not the right way to address obesity, and we need to have better markers, and body composition analysis is one very important marker, because visceral obesity and visceral adiposity, that's fat around your organs and fat around your waist, is the driver for majority of the problems. So if we are going to use only one marker, it's not enough. And I think body composition analysis in the longer run and in future is going to be a good marker for us. I think women tend to put on more weight over a period of time, because women go through a lot which unfortunately men do not, because they may get affected because of obesity and PCOS and infertility and maybe pregnancy. And pregnancy by itself is a stress test on the metabolic situation inside. And pregnancy, post-pregnancy, lactation habits, weight gain during pregnancy, then and again another pregnancy. And after 2 pregnancy, you have not much time to recover. Osteoporosis sets in, and then you are into menopause. So this cycle for women lasts for around 10 to 15 to 20 years, which predisposes them to go into metabolic problems. And I think there has to be a very good systematic approach, because pre-pregnancy, post-pregnancy, lactation habits in our country are not up to the mark, and that itself triggers women to go into obesity.
Yeah. So both of you have touched a little about this fact. Yeah. You wanted to add something, sir, Dr. Mithal?
Just adding something, what Rajiv is saying is irrelevant actually. And the
Right.
important point is, when you look at the obesity curves in India, girls are not more obese than boys. The line crosses in the late 20s somewhere,
Right.
where women start becoming more obese than, or more overweight than men. So as youngsters, it's not necessarily true. So that's exactly what he's saying.
Yeah. So I was saying that both of you have touched upon this fact of visceral fat, and now we know our in the understanding is evolving that BMI is not a very good marker uh, for uh, for measuring obesity. What exactly then should we do in order to understand whether my weight is appropriate? It will really help understand our viewers what they can do about it and how they can understand their bodies better.
So I think BMI has lost some of its sheen and importance, but
Right.
it's still there. And if you
Hmm.
use BMI, then you have to use a different cutoff. So, for
Right.
example, the whole world says at 25 you are overweight, a BMI of 25. In India, we say at 23, because we start seeing the metabolic effects of fat at that lower BMI, because much of our fat is inside. That's why. So I think that's important. You could also, to find out what your health is, really look at the waist hip ratio, another conventional way of looking at it, but very helpful. And Indians particularly have a bad waist hip ratio. you know
Yes.
so basically, if your waist is significantly greater than your hip, then that is a problem. That is clearly a
Mhm.
problem. So then, of course, nowadays, at least in cities and in most clinics, you will have these body composition analyzers, which are very accurate. It takes few seconds actually to record your body composition. They're not the gold standard, but they are very useful clinically. And if one really wants to go in a research setting or studying some new drug, then that bone density machine that we use for measuring bone density, that has the capability of measuring body fat distribution also. I
Okay.
think, excuse me. So I think there are many ways to measure obesity, visceral obesity, even if this Delhi pollution. So even if we stick to BMI and waist hip ratio, we can get a lot of information. And if we have access to body composition analyzers, that will certainly help us. So I think you also look start looking at the consequences immediately. You start looking at the blood glucose, how it's behaving, the lipids, how they are behaving. That also will help you assess the impact of your obesity.
Right.
Right. So those are the ways that we decide whether I am healthy or not.
Yeah.
One
There is a
more
related
more.
question. Yeah,
Sorry,
sure.
one.
Sure.
So I forgot to mention about muscle mass. The ratio between the fat and the muscle mass is also very important. So if you have not too much fat per se, but you have a high proportion of fat as compared to muscle, that's pretty harmful, because muscle mass keeps you healthy, improves your insulin resistance, lowers risk of diabetes. Now, other way around, if your body proportion is mainly fat, even though you are quite lean, and the lean mass is less, visibly you are lean, but the muscle mass is less. That ratio is also quite important.
Yeah. Very important points there. So there is a related question. When you talked about the measures that parameters that can be used in order to understand whether I have healthy weight or not. But even if I am obese, when do I decide, or our viewer can decide whether they need to go for a therapeutic option in order to control their weight, or just lifestyle measures can control their problem that they have? Dr. Kovil, would you like to answer that?
Yeah. So one is that I think in another 3 months we'll have a newer definition of obesity, and importantly, I think in India and in many parts of the world, obesity has been recognized as a disorder or disease. So one that is not yet done in India. So today, culturally, overweight people are considered healthy and lean people are considered unhealthy.
We have
So
this thing about khate pite ghar ka thing that is often
absolutely,
said.
absolutely. So
It's
so
changing, though.
I,
It's changing.
Yeah.
it's changing. So it's changing. I think we are on the right way, and I think once you have a BMI which is higher and a obesity related condition, medical condition, which could be diabetes, could be blood pressure, could be obstructive sleep apnea, osteoarthritis, non-alcoholic fatty liver, any of them, then you obviously have to start treatment to reduce the obesity, because what data has shown that 5 to 10% drop in weight can help you in controlling all these problems. So
Right.
with one particular control, you could have a multifaceted approach.
Right.
So I think there is where the whole understanding lies, and that's where I think obesity needs to be recognized as a disorder, and obesity needs to be treated by experts who understand the disorder rather than a cosmetic problem. And that's
Right.
where we need to advocate more about obesity being a medical issue, and treating it would have a lot of ramification on multiple other metabolic problems.
Yeah. So my question was also about when do the roles of experts kick in, and till what time or what limit can I push my boundaries to change it without probably going for any medication or any intervention.
I guess the as I was saying, it's good to check the parameters. If you're overweight,
Right.
you can run your blood test, check your parameters. If everything looks good, then you really should be working towards weight reduction. Because as Rajiv said, basically, if you lose 5 to 10% of your body weight, even if you're not achieving ideal body weight, you're reducing your risk very substantially. Now, how does one do that? It depends. So you should have a time frame. What I recommend to people I know is have a time frame. Say, okay, let's say I'm 10 kg overweight. Okay. So my goal is to lose about 5 kg in next 3 months. It's a moderate goal, reasonable goal. If you don't achieve that, then seek help. Okay. So one is, if you're healthy, otherwise your parameters are great, you're not achieving your goals, please go to the nutritionist, at least a qualified. That's another problem. Qualified nutritionists are all mixed up with all kinds of pseudo nutritionists. So go to a proper nutritionist, get advice. But if she suggests that there could be something more, something metabolic, something endocrine, then almost certainly need to see the specialist. Also,
Right.
if you're showing abnormalities in your blood glucose, in your lipid profile, in anywhere, in your liver function test, I think straight away you should go to a specialist.
Yeah. So that brings us to the next question that I want to ask, and that's around the current, we have been hearing for the last few years a lot about these blockbuster diabetic medications, which also helped a great deal in controlling obesity. Can we talk a little about that, and whether these in what way are these medications also available to Indian patients? I would like both of you to please answer this. Dr. Kovil, would you like to start it?
So again, before I start answering it, the core problem is we need to recognize obesity as a disorder and not a cosmetic problem. Because only when we recognize this as a disorder is drug or pharmacotherapy comes in. Till that
Right.
time, a patient, if suppose somebody wants to get into a good outfit or wants to look good in a photograph, maybe after 15 days and forget about it after 15 days, or it's like a bridal package, it's not going to help. So
Right.
importantly, we need to recognize that this is a long-term problem and
Mm-hmm.
this is a disorder. And when you start eating less, the brain itself sabotages weight loss. It reduces your basal metabolic rate. So these new drugs which have come in, and especially in the last 7 to 10 years, and they work as anti-diabetics at lesser dosages, and when the dose goes up, their effects on weight increases. And this is the satiety hormone. Like me and Dr. Mittal could go to a buffet table and we both may like the same kind of food, but he may end up eating lesser and I may end up eating more, just because the hormone is not working in me. So these drugs gives you satiety at lesser food. It reduces the movement of your stomach, so you don't end up eating more. So highly refined food you eat, the stomach moves faster, so you can end up eating more. It gives you satiety signals in the brain, and that's how you end up eating lesser. And over a period of time, the person will lose weight, and eventually all the problems of weight will go down. So this
Yeah.
is not a kind of a quick fix solution, because along with this there has to be a behavioral therapy, there has to be lifestyle change and everything for carrying it forward. And obesity, as diabetes is, cholesterol is, blood pressure is a lifelong or a chronic problem, and therapy should also be long term. It's not short term and you stop it, it's going to regain again. So
Yeah.
your thoughts on it?
Yeah, so Dr. Mithal, I wanted to understand semaglutide and drugs like tirzepatide in higher doses, especially for obesity, are not available in India yet. But going forward, do you see, because of the lifestyle that we are having, acceptance and demand for these drugs whenever they are available will really be high in India? And these are the drugs we have to live with now.
Yeah, I have to make a couple of points before I move to answering the
Right.
question. Those couple of points are: number one, the key in managing obesity, the obesity epidemic that is threatening to engulf India, is prevention.
Right.
It's very important that we change our habits, our eating habits. In fact, ensure that our kids are exposed to the right kind of food, and therefore they don't develop those kind of taste buds and those kind of habits and obesity from childhood itself. I think this is really important, because drugs will come only for those who really require medication. But the population as a whole cannot be on medication. That has to be prevented. That is one important point. The second point is, of course, that while all of us talk of obesity as a condition, or overweight as a condition or a disease, patient motivation is highest for cosmetics. So for cosmetic appearance, they will do anything. And when you tell them you're a little overweight, they look, where am I overweight? I'm not really bothered. But if there's something to strikes their brain that I'm not looking good, then they will do anything to do that. So remember that plastic surgery, for example, is one of the most expensive specialties in the world, because people are willing to spend much more for that kind of thing. So that's human psychology. You can buy into that as a doctor. You can use their craze for better looks to translate into health benefits by using appropriate strategies. Uh,
Yeah.
Very rightly, use of these drugs is part of a program. They are not candy that you can just have it, or even an aspirin that you can have and get rid of a headache. It's part of a weight management program where diet, exercise. Now, for example, if you don't exercise and you take these drugs, right, and you're not doing weight training, strength training, you lose significant amount of muscle also. So these days, people are going nuts. They're going crazy about these drugs, and they're not doing anything except procuring the drugs from somewhere through resources, and just they've started using them without having the baseline tests done, without whatever the markers for any side effects. All that is not being done. Having said that, there is no doubt that if used in the right patient judiciously and under supervision of experts, they are amazing molecules. They're amazing because they enable us doctors and enable patients to ensure a weight loss of like 10 kilogram, 15 kilogram, 20 kilogram. You don't see that with any earlier drugs. And remember, to me, this is
It was
just
not
the beginning.
possible without bariatric surgery, basically, earlier.
Tirzepatide and tirzepatide is what we are talking about. These two new drugs, which are and I think they'll become available in India sooner or later. It's not, I don't think that day is too far that you will have both the injectable forms available. We have an oral form, which is less effective, that is available already.
Yeah.
So I think that they will be very important tools in our fight against disease. And both semaglutide and tirzepatide have shown remarkable benefits in reducing blood glucose, reducing body weight, as we are talking about, reducing liver fat, reducing progression of kidney disease, reducing progression of heart disease, reducing risk of coronary events. I mean, that's amazing. So they really will be a very important part. And one important point here again is that while they are very important, this is just the beginning. Scientists have cracked the code. You will have drugs that act on 3 pathways at the same time, retatrutide, others survodutide, some that will preserve muscle mass. All kinds of. In next 5 years, I see this area really exploding. And this is just the beginning, and quite fascinating if used correctly.
Yeah, very insightful information, sir. Really appreciate both of you joining us for this discussion. And to our viewers, we have a request. If there is a topic on which you want us to discuss, please do write to us in the comment section. Thank you so much, Dr. Mithal and Dr. Kovil. Really appreciate it.